Okay, I guess we will start. Yeah. Good evening, everyone. Respected Dr. Neeraj sir, members of the IADPE, and dear doctors. So we welcome you back for another episode of Learn from Our Master series organized by IADPE, and it's always a pleasure to be here. So for those who are attending our webinars for the first time today, I would like to give a little bit of introduction of ourselves. We are the International Association for Dental Practice Excellence, a dental platform in which we believe quality education always ensure predictable outcomes for dentists of all disciplines and abilities. Our organization is established based on the fact that the dentistry is complex and requires ongoing learning experience. So we conduct various webinars and workshops to enhance the skills of dental professionals and guide their dental journey. So, without further ado, let us start our series episode in which our topic of discussion is the digital smile design 2D to 3D workflow given by Dr. Neeraj sir. To speak a few words about Dr. Neeraj sir, Dr. NEERAJ S Rohida is an associate professor in orthodontics and a clinical researcher. He has to his credit research articles published in American Journal of Orthodontics and World Journal of Orthodontics and is a mentor to PhD students at IIT Mumbai. Since completing his masters in orthodontics from GDC Mumbai, Dr. Neeraj has been into exclusive orthodontic practice at Mumbai, India. He is the developer owner of the DTS Pro, DTS 3D, and other upcoming softwares under the DTS umbrella. DTS is recognized as one of the top five softwares in the world. So without wasting more time, I would like to invite Dr. Neeraj sir for today's discussion. Sir, please.
Thank you, Dr. Shanu, for the kind introduction and welcome all delegates to an interesting topic of understanding the digital smile designing protocol. Well, smile designing is the in thing in dentistry, if I may use that word, right? Smile designing has been carried out since ages. So what is new? How is it different? How does the digital platform make smile designing different from the analog platform? Is what I will try to throw some light on in this brief webinar today. I'll be open to any question answer sessions at the end of the lecture, and we shall make this a total discussion, right? So let me start sharing my screen. I hope my audio is clear. I am visible.
Yes, sir.
Kindly excuse me. I have got a bit of cold today, so I might just take a sneeze break in and out. So let me share my screen. So I hope my screen is visible. I'm audible, and let us begin with the topic of understanding simulations and digital planning for the modern dentist. So before I begin, that's a little snapshot of our practice. I practice in a place called Powai, which is in the heart of Mumbai. So those are our operatories, and this is where, of course, the entire clinical uh, procedures are carried out, and that's the area where a discussion room, if I may use that term, or a consultation room, and I will just come back to why I feel the need to put up these pictures before beginning a topic of clinical smile design. Right. Now, understanding that we as dental professionals, right, we are doctors and we are dental professionals, but we also have an important business aspect to take care of, right? That is why the terms ethical dental marketing, it is one of the most important factors of running a dental business. And there is no shying away from the fact that most dentistry is want-based rather than a need-based specialty. As most of us would agree, any patient who walks into the dental office many a times has a subjective complaint that I want my teeth to be better. I want my teeth to be whiter, straighter, so on and so forth, but I don't necessarily need it, right? So there's a difference between a want-based and a need-based treatment. I always quote the father of orthodontics, and I'm proud to be an orthodontist, the father of modern orthodontics, Dr. William Prophet, who has made a very profound statement when he says that nobody ever dies or has died from malocclusion. Isn't this a brilliant statement which sums up one of the major aspects of dentistry, that is the subjective aesthetic aspect of dentistry? And every treatment in dentistry, be it orthodontics, be it full mouth rehabilitations, and of course aesthetic dentistry, has the most important aesthetic component attached to it. And again, why do I stress the need of this is because aesthetics is a very subjective term, right? Something which I love or I like may not be necessarily reciprocated by my patient. What is good in my eyes may be okay in somebody else's eyes, and so on and so forth. So the entire idea of digitizing the smile design experience is to make the patient, the lab technician, and the dentist come on the same page. This is the core line of today's webinar, understanding how digital tools help us achieve the goal of having a repeatable, predictable outcome almost every time, right? So coming back to the presentation, we now understand that ethical dental marketing is one of the very, very important means of being in the dental business today, right? We already keep honing our clinical skills. That goes without saying. So what then is the roadblock in between? Is getting the patient from your waiting room to the dental chair. In short, making the patient say yes to treatment, right? And when and why would the patient do yes to treatment? Of course, we will just understand the workflow. Now, why did the thought process of developing a software of showing patients prospective smile design come to my mind in the first place? Now you look at this beautiful lady on the screen, right? When a 30-year-old pretty woman sits in front of a dentist and tells us that, doc, I want these gaps to be closed, the first impression, the orthodontist in me starts screaming, braces, 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 right? Now, understand, a middle-aged woman, the moment I tell her that I can close that diastema for you, but I'm going to put you on braces for a period of 1 year, the first impression which comes in the patient's mind is, no, doc, not braces, definitely not at this age, and definitely not for 1 year. Because braces are now then associated with that geek nerdy look, right? So the moment I have sort of opened my mouth, now understand, a patient says, when a patient walks into the dental office, right, there are already certain preset inhibitions and apprehensions. The first thing which I tell the patient is braces for 1 year, I am sort of negatively reinforcing my idea of dental treatment. So coming back to this scenario, when a patient like this sits in front of me, I thought, why can't we have a tool where rather than speaking, we can show the patient something on their own smile, and not only show, what braces can do, for example, also show them how veneers would work, how composites would look like, so on and so forth. This is the era of selfies. Everybody has access to a mobile phone, right? Every patient or all of us have seen our faces along all the different angles which are possible to be shot with a phone, right? This is where photography, documentation, simulations become one of the most important. I would not say it is optional, rather, it is almost a compulsion that patients first want to see today how they would look before they want to undergo any irreversible changes on their face and on their smile. I believe everybody of you agree to what I am saying till now, right? So today when I want to get my house done, when I want to get the interior designing of my house, the interior designer cannot doesn't start by saying that, I'll paint this wall red, I'll paint this yellow, I'll give. What he does is he gives me a 3D representation of what the future house is going to look like. It starts with a vision. Similarly, imagine a patient who's wanting to change that smile, change that face, and I will show you cases where we dentists are blessed because we don't actually only change the smiles of patient, we change their lives too. And I will show you cases which will speak for themselves. So patient who's wanting to undergo changes in their smile, definitely in today's world, has a vision where they want to see how the prospective smile is going to look like before they undergo anything irreversible. So that typically what do we do when we see a patient, say for example with a diastema, is a third of this webinar participants would think of doing braces for this patient. Other third would say, well, veneers are the best possible option for this. And a conservative third would say, oh, I can close this with composite bonding, single appointment and job is done. Again, understanding that when I am a patient who doesn't understand dentistry, I am a patient, right? I am not a dentist. First of all, understanding the nitty-gritties of what treatment would look how in my mouth is a challenge, and then deciding amongst them. Sometimes even me as a dentist have got this confusion of, oh, should I do braces or should I do bonding? This is where digital tools help even we as dental professionals understand how the aesthetic outcome would impact our decision making, right? So typically what again do we start doing is we will show our patients some before after cases which either we have treated or we have got somewhere from the internet and show them, oh, this is how your gaps are now and this is how it will look after the gaps close. Now that's a brilliant picture on the top, but again, understanding from a patient's perspective, how do you think a patient can relate this to how she would look after the bonding is done? She can only see teeth here, right? Or of course we use certain similes saying that, a veneer is something like a contact lens which goes and sits on top of your eye. So I am going to do something like that. That is something stick on top of your teeth. Or of course, we'll show them models. So these are the conventional ways of getting the patients understand the implications of aesthetic treatment, right? Of course, one of the most predictable methods of giving the patient a vision of how the smile would be to do direct or indirect mock-ups. But again, understand, we would spend our time, effort, energy, and of course, lab fees for patients who are already motivated for treatment. What about a patient where me as a dentist, I see a lot of prospective potential in the patient's smile? Would I ask him to sit on my chair so that I can show you how your diastema will look after you get it closed? The patient's response is, doctor, don't sell treatment to me, right? I don't need it. My iPhone is more of a priority than getting that diastema closed, right? Imagining the same scenario, if I am able to use pictures, all I need is a single picture of a patient and give them a vision that this is how possibly your smile can be improved or your smile can be enhanced with dental procedures. After this, I don't need to talk. Now my pictures are doing the talking for me, right? So typically, if I divide patients into group A, group B, and group C, where group A is a patient who's already motivated for treatment. Say, for example, this lady is motivated for treatment, but she wants to understand how additive dentistry would look like versus how orthodontics would look like. So I can show her simulations of the lower left being an additive simulation and the lower right being an orthodontic simulation. Again, now the patient comes up and tells me, Doc, gaps are closed in both the cases, but in the lower left picture, I feel my teeth look too broad. I am not sort of superimposing my views right away from the patient. I will come to that. But now the patient is coming back to me because I've given her a pictorial depiction of both treatment possibilities. Right? So now come back and rewind the entire conversation again when the patient is sitting right across my chair and telling me, Doc, I want that diastema to be closed. My conversation moves to saying, definitely, we can do that for you. Would you mind me taking a single picture so that I can understand and do some measurements? And while I have taken a picture, I can quickly carry out a simulation, and I will show you the process typically of how do you do a 2D simulation and of course then a 3D replica of it, and show it to the patient that yes, we can close your gaps in these possible ways. And now you see the conversation has now moved from I want you to do this rather than this. I'm giving you options. You pick and choose. Because as we discussed, aesthetics is many times a subjective phenomena. Of course, I am not coming to the point that we have not considered occlusion, function, bite, so on and so forth. Of course, we as dentists are specialized in that, right? This is getting the patients tuning their expectations in the same page as with the dentist. So this is how a workflow typically globally these days starts with a picture, and then I will tell you how does it end with a picture again. So that's the first step of digital smile design workflows is a photograph and understanding the patient's expectations and giving them a little bit of visual of how the post-op treatment result would look like. Coming back to my classification again, a group A patient who's a motivated patient, but I can use simulation softwares or simulation tools to give them prospective post-op results. Group B are those patients who know that there is something wrong with their smile, or rather, let me not use the word wrong, something can be improved on in their smile. But for them, probably going on a vacation or buying that iPhone is more of a priority rather than investing in their smile, right? For such group of patients, a single picture can do wonders where we can show them before after results and get the patient saying from I want smile design to I need my gap to be closed. And of course, group C patients are those patients who tell me that, Doc, you know what? That diastema brings me luck, or that high placed canine runs my business. In short, these are patients who are not at all motivated for cosmetic or aesthetic dentistry. And even if I break my head on the wall, I'm not going to convince these patients and turn them into a group B or a group A patient. So that's about a bit of understanding patient psyche. So that is how we started developing this software since 2017 by the name of DTS. Of course, I am here to talk about the workflows. I'll just give you DTS software because we use that. And to have a tool which is simple to use, user-friendly, and quick. Sometimes, again, you want to show the patient simulations and treatment plans right in the first visit. The patient is not going to probably come back after 2 days to just look at a simulation, right? So it has to be quick and easy and practical to use in daily clinical life. Okay, so that's a bit of introduction about simulations and the importance of simulation in today's clinical scenarios. Let me come back to a few cases and then we shall run through what do you mean by an analog smile design workflow versus a digital smile design workflow. Again, a patient who came to our dental office, not primarily for getting that asymmetry corrected. We could see that there is a lot could be done for this patient, but he had specifically come for a wisdom tooth extraction. Now, the patient was happy. He's come to get the stitches removed. And all I request him is probably let me take a single picture and then show him something like this. And you know what? While I was seeing you, I observed that we could do something to improve your smile. You could think about it later. And we just gave him this simulation. Of course, the patient was excited for treatment. A group B patient probably who knew that there is something with his smile, that simulation helped. The patient was ready for treatment, and you can just see his post-op results in the bottom frame. Right? Another case, a very pretty lady here. If you can just see on the upper left picture, a small gingival zenith mismatch between the upper two central incisors. And probably the way ideal should be that the central incisor papillae or zenith should be higher in position than the lateral incisors. Of course. Now, again, let us understand this point that every procedure in dentistry is a combination of an additive and a subtractive procedure, right? Anything additive, we can easily carry out simulations. We can do lab mock-ups. We can do direct chairside mock-ups and show the patient simulations. But whenever there is anything subtractive to be involved in the case, whenever it involves chipping and chopping a tooth, we cannot use any other means to showcase post-op results other than using digital tools. Coming back to that exact example in this case, now this patient needed crown lengthening or gingivoplasty or gingivectomy, whatever that would be. But again, how do I show the patient these results without putting a blade on our gums? So all I did was create that simulation on top. The patient said, oh, this small gum line makes such a drastic change in my smile. I wasn't even aware about it. Once that simulation was done, on the bottom, you can just see we did some crown lengthening, and this is after healing. We did a little bit of bondings, but not significant treatment. But you can see the change that has happened from before to after. These are simple clinical procedures. And also, let us understand the fact that not every aesthetic patient is going to be a 12 veneer or a 14 veneer or a 20 veneer case. We might have simple enamel chips or repairs. We as dentists sometimes can see that that fractured central incisor is an aesthetic handicap for the patient. But we cannot sometimes convince the patient to undergo that simple enamel chip repair with composites, which can bring about drastic changes in their smile. This is where digital tools become very useful in routine practice. So again, just showcasing that simulations can be used for almost all clinical situations, because there are only two motivating factors for the patient to undergo dental treatment, if I may use that word. One is I will be able to eat better and I will look good. These are the two primary motivational factors for patients to undergo dental treatments. Now, we as dentists, you can just only tell the patient that you will be able to look well, eat well. That is why the only motivational factor for us dentists remains showing the patients what prospective post-op results could be. So even the denture patients, everybody wants to look good, isn't it? Right? Orthodontics, again, an adult patient not wanting to undergo braces for a period of around 1.5 years, not wanting to do extractions. These are common problems which we dentists face typically across the globe. I took a picture, showed the patient a post-op simulation. This is just a simulation, right? And this is how we sort of motivate them of undergoing treatment. Not only that, we can also use digital tools to show the patient the effect of extraction versus non-extraction on their profile, right? And this is how on their own image, when they are able to see how the lips can fall back, is an altogether different type of motivational factor here. Even orthognathic surgery. Now, I understand that orthognathic surgery or myofunctional orthodontics, the most scientific way of doing a simulation or a treatment prediction is using cephalograms. But again, I come back to the point that patients do not understand X-rays. Patients cannot relate to models with wax-ups, but they can definitely relate to their own picture showing the changes, right? So again, understanding a bit of workflow of how a 2D to 3D workflow in smile design looks like. I'll first show you a couple of cases and then go into exact workflow. I hope I'm not going too fast, too slow. I'm able to put my point across. Please drop in your feedbacks. Please drop in if you have got any questions at this point of time. And thank you for your time once again. And let us continue forward. So you can see the first picture is the on the left is the pre-op picture. We did a simulation and then we did a 3D printed mock-up using the 3D software. So that's just the mock-up in the patient's mouth. And I'm just going to explain you how a mock-up is actually created. So I'm using DTS Pro. This is a software, and I'm just going to show you how the software works and how do we actually use to do the entire workflow which I'm talking about, right? Okay. Now, what exactly is a digital analog smile design workflow, and what do you mean by a digital smile design workflow? I'm just going to show you some pictures and so that it becomes clear of how is digital different from analog. Now, I will just speak through cases. There is no theory to share here. I'm just showing you cases and trying to put my point across. So this is a picture of a pre-op image of a lady who wanted to get that diastema closed. So we begin with the simulation. As you can see, we showed the simulation to the patient, got motivated for treatment. That's step one. That's patient motivation. Now, step two of using any digital software is treatment planning. So now I go ahead and use the retracted images and plan my treatment. There could be a separate topic of discussion of how to be plan treatment, but I'll just show you in a short demonstration in the later slides of how do we exactly 2D treatment plan. Now, once I've done the treatment plan, of course, we use the principles of smile design. We use certain measurements, and now we want to communicate this with the lab. So what I've shown to the patient needs also to be communicated from the lab. You're not just showing a dream and then shrugging it off, right? You want to deliver what you have shown. So now you tell the lab technician exactly the kind of simulation that you have carried out. This is basically called as a lab communication module. So typically how we used to do in earlier times and how do we do it now is where the difference between the analog and the digital workflow lies. So what does the lab do? It uses my outlines or my measurements to do the wax up on the model and sends us the wax up back in the form of a physical model, right? All of us have received, we send our impressions to the lab does the mock-up, sends us the waxed up model, and then we do a putty guide and transfer it to the patient's mouth, right? So because there are physical impressions involved here, there is a mock-up which is done by a technician. The way we learned our wax carvings in our second years, so we used to actually carve out teeth, right? So similarly, the lab technician here uses our routine wax and does the wax up and sends us the model back. This is what is called as the analog smile design workflow. We have just taken a picture here just to show that the wax up which is sent by the lab matches my 2D treatment plan. That's a picture of the mock-up. So once we receive the model, we use the putty guide index, transfer it in the patient's mouth. So that's a before after picture of my mock-up in the patient's mouth. And again, that's an external picture with the mock-up in the patient's mouth. So first step, we have shown the patient a simulation. In the second step or checkpoint, we have transferred the mock-up in the patient's mouth and again taken sort of an approval from the patient before getting into specific final dental restorations. That is how it makes this makes the entire digital smile design workflow much more predictable. Once the patient is approved, we go on and do the crown lengthening as per our treatment plan. We have used a laser in this case. Did the crown lengthening, wait for the gingiva to heal, and those are veneers cemented. So here, because we used physical models to do the smile design, the process remains the same. The clinical protocol remains the same. But because there were physical models involved, this is typically called as the analog workflow. As opposed to what you mean by a digital workflow. Now, taking another example. Now, this lady wants to get her smile corrected, right? The common protocol we follow is take pictures. Now, typically, I use two pictures, basically an extraoral picture and a retracted picture. And first step, on day one of the appointment, show the patient a prospective post-op simulation. This is where I use DTS Pro to do my simulations. Now, the patient really likes what she sees. Now, if you see, she's a patient who needs orthodontics. There is an in-standing lateral incisor there. For whatever reasons, the patient is not inclined towards getting orthodontic treatment at this point of time, but maybe needs an interim restoration in between. We still go ahead, do the 2D treatment plan using those same extraoral as well as retracted pictures. Now, this is where the difference comes. Now, instead of sending this physical model to the lab, I use the patient's intraoral scans and do the designing of the mock-up in-house using the DTS 3D, or you could use any 3D software. There are many 3D softwares available like ExoCAD, there is 3Shape. What I mean to say is I want to use the term software as a generic term to put this point across that if the wax-up is done by a human technician using carvings, it becomes an analog workflow. While if the same wax-up, if it is done using a digital software, using CAD, what do we mean by CAD is basically computer-aided designing, it becomes a digital workflow. Now, let me just give you a little insight here. You can look at this mock-up on the top right of the screen. It really looks good, isn't it? Now, if I tell you, I have done this mock-up, and if you look at my drawing, I can't even draw a picture of a tree. I'm so bad at drawings and crafts. What am I trying to imply here is, even though I may not have the necessary skills to do a wax-up or a mock-up, because I have got digital tools at my disposal, I can use them to do beautiful mock-ups. Which gets me to the first biggest advantage of digital dentistry, that is, digital dentistry makes the workflows predictable and repeatable. What do I mean by repeatable is I can use these exact tools and do a mock-up for some other patient and still give her beautiful results. So each and every time I am able to use these digital tools in making my procedures repeatable, predictable, and quicker. So this is the primary difference. You see that post-op result. It's beautiful, isn't it? The girl even looks more pretty. Could we have not done the same exact result with an analog workflow? Very well, we could have. But the principles of treatment remain the same. it is the tools involved which sort of differentiate between what is analog versus what is digital. Which one is better? Both are good, right? Digital has its own advantages, analog has its own advantages. So I will show you one more case here, and if there is time permit to show you the exact procedure of how do we do a 2D designing and how do we do a 3D designing, we will take up at the end, depending upon whether time permits us to give a short 5 to 7 minute demonstration of how exactly do you do a 3D designing. Now again, a young boy with diastemata generalized there between his teeth, and the first thing which I could notice there is tooth material arch length discrepancy. What I mean to say here is definitely, I mean, there could be an orthodontic treatment opinion here, or it could be an additive treatment opinion here. But looking at the shape of his teeth, definitely, I believe an additive treatment procedure definitely would be much more beneficial to this patient rather than braces, considering his bite, so on and so forth. I don't want to come to treatment planning here, but again, just showing you the workflow. The routine process we follow is show the patient a simulation. That's again step 1 of treatment, showing the patient a simulation on their own face. Step 2, doing a treatment planning and communicating this with the lab or designing it in-house. So till here, I can just complete using a patient's photograph, right? Again, because I've got the 3D software at my disposal, I have done the mock-up designing in-house, 3D printed it, and done the process of mock-up transfer in the patient's mouth. As you can see, that's a 3D software, and that's the mock-up. You can see the impact of a mock-up. So now till this time, we haven't touched the patient's teeth at all, emphasizing the point that you are sort of getting the patient's approval at each step before undergoing sometimes an irreversible final prosthesis, right? That is the retracted picture of the mock-up. A very important thing is doing a video before after mock-up, because sometimes pictures do have a limitation in that they do not show us the entire dynamics of the lips. Now, sometimes a single picture, the patient is smiling very broad. You might feel that the patient has got a very high lip line, while actually in dynamics, it's exactly the opposite. That is why doing a video consultation becomes a very important, a short video where you ask patient questions and see how the lips move and how the visibility of teeth go up and down as lips move becomes a very important part of treatment planning as well as your mock-ups. This is a case done by a dear friend. So that's a pre-op picture. Now this patient wanted to just get her teeth bleached or teeth whitened. For her, the primary concern was that teeth are yellow. I want to get them whitened. She wanted to get married. Now if you see, she's got fluorosis. We cannot bleach in her case. Even if we do a bleaching, all we are going to end up with is mottled enamel appearance, isn't it? But again, how do I put across this point to a patient who's coming to me with just wanting to get the teeth whitened, when I tell her you're going to need veneers and it will cost you around ₹1,00,000, for example? The patient feels, I just want to do whitening, and I've Googled that it costs me anywhere from 5 to 10,000 rupees to get whitening, and this dentist tells me he cannot whiten my teeth and he wants to give me something called as veneers and is charging me ₹1,00,000, a bomb, right? So we follow the same protocol. Show the patient a simulation. Patient says, oh yes, this is something what I am looking at. This is something what I want. We do the 2D treatment planning. We do the 3D designing and print the 3D model. Use a putty guide. use a temporary material, flowable material, and transfer it to the patient's mouth. Now, this patient did need some amount of crown lengthening. Unfortunately, I do not have a before-after picture with the mock-up in the mouth. But we went ahead and did our crown lengthening, and finally, the patient was ready to do veneers. Of course, she is a case with a very high lip line. There was very limited crown lengthening we could do here. But this is how we ended up with veneers for the patient. She still has a high lip line, but that was a surgical challenge that we accepted in this case, and the patient was okay for this. Right? One more case here. Again, a midline diastema and peg laterals was not ready for orthodontics. The same protocol, we did a simulation there, did our 2D treatment planning, did the 3D designing in-house. We also had a face scan for this patient, so I've just put, we did a face scan, so the face scan definitely can give us the visualization in 3 dimensions. And we 3D printed the mock-up in this case and just fixed it in the patient's mouth. We also use this for temporization. And that is how this is just a mock-up cemented in place, right? And again, we did a video for this patient here. And you can see the lip dynamics. You can see the way your mock-ups show through. So the patient is on the same page as far as aesthetic expectations are concerned. I want to run through a couple of cases more, and probably we can then have some discussions if there are any questions. So again, a patient who, as you can see on the left, these are cases which we come across in routine practice with hardly any teeth visibility. Now, this is a very fit young guy. He's today 50 is young, isn't it? He's a fit guy, but his teeth don't show through. So his age, he appears older than he actually is because of having reduced visibility of his teeth. Now, let me tell you, he's a dear friend of mine. I used to always tell him that, you should do something about your teeth. To the extent that he started avoiding me. And why is that? Nobody likes pushing, isn't it? Our patients are the same. They have come to us with certain expectations of getting something else. The moment you start pushing onto some treatment, they become averse to it. What I did was just do a simulation for him. I need not speak a lot after this. Now he's behind me to get his teeth straightened, to get his visibility increased. And we follow the same protocol of using the retracted image, doing the simulation there, doing the 3D designing. That's the 3D design. Of course, this is a pre-prep mock-up. That means we haven't done anything to the teeth, right? So many times when we are doing mock-ups, the mock-ups do look a little protrusive because you are adding something onto existing teeth. You haven't cut. While in the clinical situation, you're going to cut teeth, right? So that's the 3D printed mock-up in the patient's mouth. Yes, I will give you a short demonstration of the software probably after we finish 1 or 2 of cases. Again, a case here with lower diastema, the same protocol, 2D simulation, 3D designing, 3D printed mock-ups, and lower veneer cemented in place. Now, if you look at this picture, there is a stark difference in her before and after picture. And you can see when the patient comes for a post-op picture, suddenly the hair opens up and lipstick magically appears on the patient's face, right? Emphasizing the point that smile design changes not only the smile, it changes the entire attitude and the persona of a patient. This is the smile design experience that sort of differentiates what a good aesthetic dental practice is from one which is not. Right? An interesting case here of a patient who came to me saying that I just want that central incisor to be straightened. Now, I unfortunately do not have this patient's OPG, but I couldn't have done anything to only one of his central incisors, right? He's a case who would have needed much more than that, but he was not interested. I told him, let me show you a mock-up. I did a simulation for him. He said, oh, I like something like this. I want to do something like this. We did a retracted image, did the 2D treatment planning, did the 3D designing. Now, this patient was not a candidate for a mock-up because he already had extremely protrusive teeth. But still, I went ahead and did the mock-up for him, 3D printed the mock-up. This is how the mock-up ended up to be. Just excuse me for a minute, guys. Sorry for that. Sorry for the technical glitch again. Yeah. So I think I'll just, yes, sorry for that. Yeah. So again, the patient eventually liked what he saw and we did an extraction, a bridge for him. Right. So the cases are similar. And again, an interesting case here where we use the same protocol. We did a simulation. Now, this was a case who had a bony defect, right? We couldn't do a lot of veneers for him, but at least we wanted to. And if you look at his smile, because of the defect on the left hand side, you see the teeth, the length is so long, but we just did composites for him and we could restore a lot of confidence back in his smile. So you can see that after picture there, you see the before and the visibility in the after picture, right? So the idea of any digital software is to have a clear, predictable communication between the patient, the dentist, and the dental lab. Because when a lab technician does a design, he doesn't know how the patient looks like, right? And the patient has not seen the lab technician, and so on and so forth. So, to establish a clear communication as far as understanding of aesthetic expectations is concerned, digital tools go a long, long way in making this a much more predictable, repeatable, and quicker outcome. So that ends my short presentation on what exactly is a digital smile design. And yeah, I think we can take 5 minutes and I will just want to do a small demonstration of how do I upload a patient's picture to how do I do the 3D designing using the 3D software. Let me. So I'm just sharing my screen there. Okay. So that's the 2D software that we call DTS Pro. Now, I've uploaded the patient's image here. Whether you use a mobile phone or a DSLR phone camera, a DSLR camera doesn't really matter. Though, if you look at the picture quality, having studio lights and DSLR camera cannot be compared with using even the best of mobile phones. So, for an aspiring aesthetic dental practice, having a good DSLR camera and studio lights definitely gives you a documentation which cannot be compared or paralleled by using even the best of mobile phone camera. So that's my little two pieces on that. Now, once I have uploaded the patient's image in the software, it automatically detects the smile line, the interpupillary line, and the midlines. Now, the first step is what we called as instant smiles. As the name suggests, these are instant motivational mock-ups. Sometimes the patients just want to see. You do not have time to say, have spent 15 minutes on the simulation software. You can just create very quick simulations using certain ideal smile templates which are included in the software. Use these tools to sort of design the new smile and give the patient a very quick before-after view of how the prospective post-op results could be. Now, this here we have not done a very detailed treatment planning yet, but we have got the patient, so to say, motivated or excited for treatment. So the first most important function of a digital smile design software is to act as a patient motivational tool, right? Not only that, as we just discussed, we can use the software to do simple processes like I'm using the tools here to show the patient how crown lengthening would look like, right? I'm just reshaping the gingiva. All it needs me is a few strokes. Now, I can also use the software to show the patient how prospective post-op results would look like with additive dentistry versus orthodontics. So here, as you can see, I've added something onto the teeth. I can even whiten the teeth, right? So I can do this while I'm talking to the patients many a times. Gives them a fair bit of idea that this is how it is going to be. And they can very clearly understand that something has been added to existing teeth here. Versus the same patient, now we can go ahead and plan treatment. This is what is called as 2D treatment planning or the lab communication module. This is for me. So I am doing the treatment plan here. I am trying to understand the patient's gingiva, the patient's incisal position. Of course, I am supposed to know the bite and occlusion. That goes without saying. But this is aesthetic planning, right? Using patient photographs. So this is how I am sort of designing where my outlines of teeth could be. Now, understand to what extent we as dentists want to get into digital terms. There are many dentists who say, I just want to use these digital tools to motivate my patient. That's about it. And I want to come back and start doing my clinical work. My lab technician will do everything for me. Absolutely valid. Totally depends upon your interests, your aptitudes, right? Me, for example, a little nerdy guy, would like to do my 3D designing in-house. Somebody would rather want to do more of clinical procedures and tell that the lab will do this for me. But I can at least get the patients motivated for treatment. I can at least use it for my simulation purposes. So now here, I'm actually designing my case in 2D. Of course, there are tutorials which are available on the website, and we'll definitely share all the resources with you. These goes true with most digital softwares, which are every software has got its own strengths. So I'm just trying to show you again how the workflow goes. So this is the 2D treatment planning. This is basically for lab communication, because you are designing this to tell the lab that this is where I want my outlines of veneers to be. But again, I go ahead and add some textures to make these simulations realistic so that even I can show it to my patient here. So that looks like a treatment planning for an 8 veneer case. Now that ends my 2D. Now what do I do, or what does the lab technician do to design in 3D is, now I will start by uploading the patient's jaw scans. Now this is a different software. This is DTS 3D, the 3D software. I have uploaded the patient's intraoral scan. I repeat, it depends upon the dentist whether he wants to just use the simulation possibilities, or he wants to do the 2D treatment planning on his own, or he wants to do the 3D planning and 3D printing in-house. There is no right or wrong. Totally depends upon your interest, inclinations, aptitude, right? I'm just showing you the workflow. So now I have uploaded the upper jaw scan. Of course, there is a little bit of learning curve which is associated with using a 3D software. Now I am trying to overlay my 2D pictures and 3D intraoral scan. So I have overlaid my 3D scan on the picture. And why am I doing that? Will be clear in a second. Now you see, those are the outlines which I had already designed earlier in my 2D. So now they become a guideline for me. It's like when you start drawing the picture of a tree, you don't straight away take colors and start making a green and a brown and a leaf, right? The first thing that we'll do is we'll draw outlines. Similarly, we first do the outlines on pictures and then use those outlines as a reference to place our teeth in 3D. So this is the designing which I am doing in my 3D, that is DTS 3D software. I am using those outlines as a guideline for me and understanding where the positions of teeth would come. Now, it has taken me 5 to 10 minutes to do this mock-up, right? Of course, this is a slightly faster mode, but it takes me 5 to 7 minutes to do a mock-up, right? With different textures. This is the power of digital dentistry. I can use teeth shapes of so many size, so many textures. You can see I can experiment with so many different shapes of teeth. With an analog, I cannot do 10 different wax ups. And even if I want to do 10 different wax up, it will take me at least 2 hours to do one wax up, and 10 different wax ups like that will take me so much of time. With digital tools, we can try out the different shapes at the click of a button, right? So you can see those beautiful textures, natural textures, which are there on the shells. So I can now see that this is how the mockup is going to look like in 3D. Now I do some wax up steps. Basically, I'll refine the shape using my wax up tools. It's just like the wax up, right? We used to use our knife and flame to use our wax ups, manual wax ups in college. Now we use digital tools to do the same steps. The protocol remains the same. The treatment planning remains the same. The workflow is what is different. See the ease with which the digital tools work, just like hot knife in a butter, right? So now that's my mock-up, which is ready almost. For those of you who know the basics of 3D printing would understand what is this step is. You basically need to process a model before it can be sent for 3D printing. So basically here, I have made this model ready to be sent for 3D printing. These days, 3D printers are not very expensive. You get so many different types of 3D printers. And 3D printing is where a lot of dentistry is headed to, right? So eventually there will come a point in time where most of us would be familiar with 3D printing. Most of us already are. and the rest of us would eventually catch up, right? So I can now 3D print my model or my shells. So that's giving you a basic understanding of what a 2D to 3D digital smile design workflow is all about. So that ends my presentation. I hope I was able to put at least some points across. I know 1 hour is too short a time to talk about the entire plethora of this domain of digital dentistry that is. Digital dentistry is not the future of dentistry. I disagree with that because digital dentistry is the present and the future of dentistry. And all of us have already embraced digital means in our practices. I repeat, having an intraoral scanner and a 3D printer alone doesn't define a digital dentist. If I'm using a camera in my practice, I'm already a digital dentist. If my lab technician is using a 3D software to do my crowns, he already is a digital lab technician, right? All of us are already into the digital dental domain. To what extent do we use the tools? As I said, the journey of a digital dentist begins from a picture, ends with a picture. And how is that journey? The patient walks into the dental office. I start with a photograph, do a simulation, do a treatment planning, 3D design the mockup in-house, 3D print it, use those mockups to design my final restorations. Now, there are many practices who even do the milling in-house. Most of us have heard that you can even make these veneers in-house, right? I have not gone there. I finish at the mockup in-house and then send it to the lab to deliver my final prosthesis. Veneer cemented in place, and again we end with a photograph. So we start the digital smile design journey with a picture and end it with a picture. How much of this journey do you want to undertake with the available tools at your disposal is totally your call, right? There is no right and wrong. My 2 bits into this is digital dentistry makes life very easy, not very easy, makes it much more predictable, repeatable, and definitely quicker. And with practice, definitely easy than the analog workflow. So with that 2 bits of what I am just doing is, of course, I am here to basically talk about the design workflow and arouse your interest in this beautiful field. But because I have spoken about the software, I will just share the link on the message here. That's dentaltreatmentsimulation.com. That the website about DTS. You will get all informations there, and maybe I can share the contact details of my support team if at all there are any questions from the regarding the software. My support team will be more than happy to answer them for you. I will just put up the number to the support team as well. It's there on the website, but just for your reference, I shall put it up here. So that ends my presentation. The website is dentaltreatmentsimulation.com. It's dentaltreatmentsimulation.com. So all the training tutorials regarding the use of the software are available on the website. This is supposed to be a sort of self-learn software. Definitely the 2D part of the software doesn't need a lot of training. It's a straightforward, simple process. But as with anything in life, there is a little learning curve associated with anything, right? The day we buy an intraoral scanner, it doesn't suddenly become magical that we become experts in scanning. We need to get our hands trained to it. Similarly, there is a learning curve associated with everything. Having said that, it's a simple, straightforward software to use, at least the 2D part. And once you become a little familiar with the 2D tools and digital tools, you will definitely want to venture deeper into the digital dental domain. And it's a very interesting domain to be in. So yes, do get your hands dirty with the digital dental space, right? Dr. Shanouf, if you can just take some questions, and I believe we can then.
Definitely, sir. Definitely. So I would request the audience to please post your questions regarding about the topic discussed today. And again, I'm requesting the audience, please try to post the question which is relevant to the topic. So yeah, so that's most of the questions is regarding about where the software is available, what's the price, everything. I think it's already been answered. The website and the contact number has been already display. I mean, placed in the comment section. You can please do check it out. So, is there any other questions regarding about this topic?
Okay. Somebody has asked an interesting question here. I mean, this is more related to a personal preference, but do you charge anything for the mock-up? Uh, it's your dental clinic decision, but just to give me my two bits here, if my patient, say for example, wants to go in for veneers, we absorb the cost of the mock-up. If not, we charge them separately. So just to give a little heads up there. I am not an expert in 3D printing, and probably, Dr. Shanu, we could just have somebody. I'm not sure if it has already been done earlier, but there could be a session where somebody can throw light on the role of 3D printers in dentistry and applications, and just make them understand the
Definitely,
cost and the
definitely.
different
We'll try
types.
to
Yeah, yeah,
keep a session regarding about it. So.
yeah, yeah. No, see, the question here is, will DTS eliminate, or DTS or any other software eliminate the use of face post for candid smile treatment? I mean, these are tools, right? I cannot go to war with a single instrument. Similarly, I cannot do my entire dental treatment using a single tool, be it a camera, be it an intraoral scanner, or be it a software. These are tools which will help us streamline the entire process. So as far as canting is concerned, these tools help us to decide where is the canting, which is a tooth that is causing more of the canting, so on and so forth. It will not, it to an extent may eliminate the need for Facebook, but I cannot necessarily guarantee in all the cases it will. See, the basis of treatments in dentistry remains the same. These tools make life easy for us. It will not replicate or it will not replace us or our dental philosophy structures, right?
Okay, sir. So there's a question regarding about mock-up. So they're asking whether can we do a wax mock-up before crown lengthening procedure?
Yes, we can. And that is how we normally do. Now, again, there are two things here. If I just want to show the patient a crown lengthening using the picture is the easy. Sorry, Dr. Shanuf, you're saying something?
No, sir. No, sir. Please continue.
Yeah. So if I am just wanting to show the patient how a crown, a lengthened crown would look like, I just need a picture, maybe a retracted picture, and show it to the patient, not touching it. But now, if I want to do a mock-up, and that mock-up involves crown lengthening or gingivectomy or gingivoplasty, I will build my mock-up to be in the ideal position with the gums cut. So my teeth will, my new mock-up teeth will be the ideal size which I want after the crown lengthening, right? So what will in that case happen? The composite will just flow over the gingiva. Because this is just a mock-up, any which ways I'm going to take it out after an hour or so, that, that composite flowing over the gingiva does the job for me, tells the patient this is how I'm going to look like. And in fact, later on, you can use that same mock-up to then place your gingivectomy incision. So that also becomes a guide. As I discussed in the first case, which I discussed with you about the analog workflow, we did the crown lengthening through the mock-up itself. The principles of smile design, well, there are a lot of books on aesthetics. I will just probably put up some references at the end in the group.
Yes, sir. So I think we'll wind up this session, sir. So if any other questions are there, we'll do try to reach out in any social media platform. So
Yeah.
definitely, I would request the audience to please do check out our sir's Instagram page where you can appreciate his clinical works. So thank you so much, sir, for sharing your knowledge and expertise when it comes towards digital smile designing. And surely many of us would leave this discussion with amazing takeaway points and implement techniques as per discussed. So thanks to all the doctors for patient listening and your participation for this webinar. And I hope all of you will depart this session with positive, confident manner. So once again, thank you so much, sir.
Thank you, Dr. Shanu, for having me here, and thank you for all the participants for your patient hearing. I want to end the session with one message, if I may use that term. Uh, Dentistry is a beautiful profession. It's a very exciting time to be in the dental field. And with the tools which are at our disposal, believe me, we can really create beautiful smiles and beautiful lives. I hope my message definitely does arouse the curiosity in young and old minds alike, and let us take this profession to great heights. So we win and the profession wins at large. So thank you everyone for your time, and have a very good night ahead, and a lovely week ahead too. Thank you everyone.
Definitely, sir.
All the best
Definitely,
wishes.
sir. We really appreciate your valuable time given to us for this series episode.
Thank you. Thank you.
Okay, and to know more about our upcoming webinars and workshop, please do check out our website, which is iadpe.org, or you can follow our Instagram and Facebook pages as well. And if you have missed our previous webinars, please do check out our YouTube channel as well. And we really appreciate if you could subscribe. So thank you all.